Let's go to this conversation now. The festive season is a time when the healthcare systems in rural areas also come under strain. Now, do these centers, though, have the capacity to handle some of the volumes that they are expected to deal with? Let's explore this now further and speak to a Treatment Action Campaign Capacity Building Coordinator, Nqobile Shabalala. Nqobile, let me thank you so much for your time this afternoon. This is an issue that we often overlook, particularly around this time. We think about some of, the urban hospitals and how they sometimes do face strain at one point or another. But would you say that rural healthcare facilities are ready to deal with a possible influx of patients this festive season?
Good afternoon to you and viewers at home. I can confirm to say that the rural health facilities are not ready. They've never been ready, and it became worse during this time. We know that in South Africa, especially in rural areas, there's a high shortage number of doctors, professional nurses, and some specialists at that level of rural areas. So they are not ready, and they won't be ready anytime. And we know once we experience these shortages of staff or human resource at facility level, we know that there's a lack of access to services that can happen. And also there can be a discouragement of patient to adhere on treatment. If you go to a clinic and then you'll be told that you need to come tomorrow, you go again tomorrow, you're told to come on another day because people have been turned away because there's a shortage of nurses. You find that a facility that can be attended by 300 people, it's only 2 or 3 nurses that are available at that facility. So this creates a high number of loss to follow, especially for patients who are taking treatment. The number of defaulters on treatment, it goes up. And those understaffed facilities, they end up making what we call medical errors, where they end up giving people wrong things. So this is actually a denial of access to services in rural areas. We know that many people who are staying in cities, they are going home now to be with their families during this festive season. So there's going to be a lot of issues that are going to happen in rural areas because their facilities in rural areas, they don't have that capacity, they don't have that manpower to be able to accommodate everyone there. And we know with such things,
Pardon me. The issue of capacity and in terms of human resources as well, we've seen it over time, particularly in some of the centers. Is it because some of these, professionals are choosing to stay in urban areas and not work in rural areas? Or is there something else at play there that we don't know?
One of the things that is happening with rural areas, if you remember, a few years ago, there was what we called rural allowance, where if you move from Joburg, you move from Cape Town to go in rural areas, you get an extra amount of money because they call it rural allowance. But now it's no longer there, and then people, there's no need to go to rural areas. Remember, if you are a parent for children that they need to go to school, for you to access better schools, you need to be in cities. Because in rural areas, there's no good schools. So that's why people, they prefer not to go to work in rural areas. They prefer to stay in urban, because in urban, there's a number of things that you can count on. Schools, even including medical facilities are better in urban areas where they have all the necessary equipment and machines that are needed compared to what is happening in rural areas. So basically, these are some of the things that are happening. And also there's issues of unpaid overtime, where you find sometimes nurses, they're going extra mile to work and overtime, but when they need to be paid overtime, they have been questioned, they have been forced to sign a number of documents that they need to prove that they worked overtime. So those are some of the things that people decide not to go and work in rural areas.
And access in rural areas is such a huge issue, just on its own, access to healthcare facilities and primary healthcare is so critical even in these areas as well. Are there organizations on the ground that are also helping to try and alleviate the pressure?
One of the things that we are doing as TAC, we've got TAC branch members across South Africa, especially in 8 provinces. in about 36 districts. So we are working there with over 250 branches. What we are doing there, we are monitoring the access to treatment during this festive season. We are also working with patients who are coming from outside areas to ensure that they do go to facilities, they do get treatment. We're also working with external pickup points to be able to issue people with medication. One of the things that we think that needs to happen is to ensure that one of the things that we want to see happening is the 12 months prescription, especially for people living with HIV and AIDS. And also one of the things that needs to be applied is the multi-month dispensing, where people need to be given 3 to 6 months supply, especially patients that are stable on ART, they should be given that time, so that it will make most of the facility to be decongested or decanted, not to find that overcrowded facilities. So these are some of the things that need to be applied by the government. We engage with the minister during our policy in action in November before the World AIDS Day to put these demands forward, to say that people be given a multi-month dispensing so that they can stay away from facilities, especially during festive season. If people have been given a multi-month, 3 months or 6 months medication, and it will open up space for people that they need medical attention at that particular moment. So these are some of the things that need to happen. We also I want also that this thing of transfer letters to be abolished, because people, especially if now I'm from Joburg and traveling home in Eastern Cape, I will be forced to, if I need to get treatment in Eastern Cape, I'll be forced to have a transfer letter from the facility that I'm using in Joburg. But to find that I don't have such kind of a letter, then I've been denied treatment. So we call also upon that to say this need to be abolished, and we need to say the Minister of Health and his team, they need to fast track the e-health, because if we've got the e-health, we just go to the facility, they punch in your ID number, then your medical records, it comes to the facilities, and there's no need for you to have transfer letters, because sometimes we don't have time to go and collect those transfer letters. At time you go and collect the transfer letters, you find out the facility manager is not there and you can't get the transfer letter, but you have to go and do it your family.
Nqobile, thank you so much for that. And I mean, as you're raising very, very valid points there, those transfer letters sometimes do become a headache. And as you say, e-health needs to come on board as soon as possible. But let me thank you so much for your time and for really just putting us in the picture of what things look like on the ground. Do appreciate it. That is a Treatment Action Campaign Capacity Building Coordinator, Nqobile Shabalala.